Ms. Anderson. My name is Sarah Lowrey. I'm a student physical therapist assistant from Jeff State, and today I'm going to be working with you in regards to your elbow.
Okay.
I know the PT saw you, did some tests on you, and I'm just going to go over some information to make sure I have it right before I start treating you today. Basically, you have what's called right tennis elbow, and we're saying it's acute because you've done the injury recently, correct?
Mm-hmm.
You had a tennis tournament about 2 weeks ago.
Yep.
4 days later, it started to hurt.
Yeah.
And then you thought you'd play tennis again 2 days ago, and it really started hurting.
Yeah.
So that's why
a good idea.
Well, and from what I see too, that you are an engineer, correct?
Mm-hmm.
So you do a lot of repetitive tasks, writing, drawing,
Yeah, I do.
that move that wrist, so that's probably not making it feel any better either, correct?
Mm-hmm.
Okay. From what I see in your evaluation, it hurts for you to draw or write when you do it more than 30 minutes, and that your movement in your wrist is equal to your left, but when you do up and down movement, you experience a lot of pain. Is that correct?
Mm-hmm.
Okay. Well, what I'd like to do to help you out with that today, first would be what we call soft tissue mobilization. We'll go through your muscles in your arms, because even though they call it tennis elbow, it's actually something that comes from your wrist. It's just the muscles that move your wrist are here, connect here at your elbow, and that's why it hurts there.
Okay.
Makes sense a little bit?
Yeah.
So as we move it, we're going to be trying to work on getting that wrist and getting those muscles stretched to where you get good movement and have little pain. Because from, I think he also did a muscle test on you, and you were actually within normal limits. You just had pain when you were doing the extension. Okay.
Mm-hmm.
So that makes some sense. All right, well, I'm going to go ahead and take your splint off. Now, the splint should be worn at all times when you're awake. You don't necessarily have to sleep in it.
Okay.
Except when you come here to physical therapy, we'll remove it. And then when I teach you home exercise in a minute, you can take it off for that. Because what it does is where your muscles attach, like I was telling you about, it kind of serves as a protector there. So it helps during this stage to keep that muscle attachment site protected. I know a lot of people think about physical therapy and think they're getting a massage. This might be a bit uncomfortable. Afterwards, it'll feel much better because we've worked through, we've gotten those muscles warm, and we've made them stretchy to where you can move your arm and your hand. Okay. Now, while I'm doing this, I kind of want to go over some things for you to avoid that'll help you during these first 4 weeks. Any sort of aggravating behavior, don't do it. Again, back to that splint, wear that splint all the time. I want to try to keep it as immobile as possible. And anything that evokes pain, causes you pain, don't do it. There's a spot right there, a little pressure there. All right, now I'm going to teach you an exercise real quick for you to do at home. Here's your handout to take with you, and that way if you forget the instructions, you've got it. All right, what you'll do is you'll stick your arm out in front of you. The purpose of this exercise is stretching. So what you're going to do is bend your wrist down to where your fingers are pointing towards the floor. Perfect. Now you'll take your left hand and push against your knuckles, very gently. You don't want to feel pain. It's simply just a stretch. Do you feel a stretch on the top of your wrist right here? Yeah. Great. You'll hold it for 5 seconds.
Okay. 1, 2, 3, 4, 5.
Perfect. Then let it rest for 20. Okay. Now, when you do that, you're going to do this for a time period of 2 minutes. So that usually equals about 10 times of doing that stretch.
Okay.
And again, we'll do it one more time. Gently. 1, 2, 3, 4, 5, and then rest. You can do this exercise 3 to 5 times a day. Again, that'll be the one time that you will take the splint off is when you do the exercise. When you're done, put the splint back on.
Okay.
Any pain whatsoever, you can call us, but stop the movement. Don't do it if you experience pain, because you're not supposed to feel pain, you're just simply stretching.
Okay.
All right. Now, I want to kind of give you an idea of what to expect during your physical therapy treatment. In about 4 weeks, thank you, the PT is going to reevaluate you. And a lot of your success in treatment is going to depend on what we do to help you, but also what you do to help. Because we're only going to see you about a couple of times a week. So these things you do at home will be great in getting you back to your normal recovery. You should be able in about 4 weeks' time to be able to write and draw and do your engineer work greater than 45 minutes. And you should have full movement in that wrist without any pain whatsoever. Complete return to function may be within 6 to 12 weeks based on your compliance and also to doing things where it's not just moving at the wrist. Like when you do get back to tennis, you're going to want to use your whole upper body to do it.
Okay.
That could be sometimes aggravating because you think everything's here when your whole arm can help you do things.
Okay.
So your compliance with home exercise, coming to see us twice a week, and doing things that don't aggravate yourself, and using your whole upper body and movement will help you return to function again in about 6 to 12 weeks.
Okay.
Do you have any questions?
I don't think so.
All right. Well, when you came in, what was your pain level at the start of treatment? 0 meaning none at all, and 10 meaning worst pain imaginable.
It was probably about a 6.
About a 6? Now, I know I've worked on you, and again, sometimes that is uncomfortable, but it is supposed to help you feel better. With that and with the stretching, what would you say your pain level might be now?
It's probably down to like a 4 or 5. It's a little bit better.
Great. And again, that's going to get progressively better each day the more you do, as long as you don't push. All right. Well, I'm going to go see my next patient. It's a pleasure meeting you.
You too.
Thank you so much.
All right.